Hey everyone, Dr. FJ, West Bend Chiropractor. I want to go over the different forms of chiropractic. So there are basically three basic forms of chiropractic. One is segmental, where they're going to adjust an individual bone. These are the oldest techniques and still the techniques that are taught in chiropractic schools. Then there's global. So a lot of times these chiropractors will do some of the segmental adjusting techniques, but then they'll have therapies like traction and different exercises you can do where you'll actually change your posture and alignment. And then there's Atlas or Upper Cervical. That's what the UC Upper Cervical chiropractors. And I'll get into some of these different technique names. And what these chiropractors do is they use the Atlas as a lever to actually correct the whole body's alignment. And these NUCCA, what I do is a form of this technique. It's obviously my favorite technique and I think the most powerful technique, but I'll get into the different ones and I'll do some other videos getting more depth in the different types of techniques. But segmental, global, and upper cervical. And basically what segmental does is they believe that you have to find a bone that's locked up and you adjust that bone, and that bone will move individually. Okay, now this can get relief. Global believes that you need to change, and they usually focus mostly on the spine from the side, the curves in the spine, and those are very important. You want 4 curves. You want the neck to go backwards. You want the mid-back to then go forwards, opposite, low back to go backwards, forwards. So my spine isn't, so you want it to look something like that, and then you have the tailbone down there. So it goes back like that. And those act as shock absorbers, just like shock absorbers in a car. So those curves really important to help minimize damage on the discs and minimize nerve tension. And what upper cervical chiropractors believe is that, and what I found to be true, is when the head goes off center, it's very hard for your body to hold it up in front. If you spend years like that, you lose the curve. So if you bring that head back over, you don't have to do any traction or therapeutic exercises or anything like that. You can if you want, but the body will bring itself back into alignment over time. And I found that to be true and to be the most powerful form of chiropractic. And the research on patient-driven issues, so getting relief, getting rid of your problems, upper cervical has the best research based on that. Okay, so what are some of these techniques called? Now, the most popular is diversified. It's the oldest chiropractic technique. It's taught in every chiropractic school, and it is what probably 80 to 90% of the chiropractors practice. Now with diversified, another very common technique that I also use as a supportive technique that I like is Thompson. And what Thompson is it's the drop tables. Ba-boom, 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 ba-boom. And what the drop tables do, it's kind of like when a jar, you know, lots of times now things are squeezable, but back in the day when you had the jar and it was hard to twist open, what you do, you tap it to break some of the friction and then you can twist it open. And that's essentially what Thompson's doing, is it's using the drop to break the friction in the joint and help unlock it. Now you'll see better range of motion, you'll lots of times feel relief, you'll have reduction in tension, but if you took an x-ray it'd look the same. So it's not actually changing alignment, it's just releasing tension. Then activator, probably the next most popular. Now a lot of people have activators, but they don't actually do it the way it's supposed to be done. Now, Dr. Terry, one of the chiropractors in our office, she's highly certified in activator and does it along with NUCCA for a lot of the patients that really like that. Then there's also a very similar activator called torque release technique, or TRT. Now these are very specific. So this is a segmental technique, but it's very specific. You challenge, so you press in on different bones and then you check the legs. Okay, you press in and then you check the legs. And what happens if you push a bone in a direction that would make alignment worse or increase nerve irritation, the body will try to protect itself and that leg will stay short or go shorter. If you push a bone in the direction that makes alignment better, the muscles relax and the leg gets balanced. Now you haven't actually applied enough force to change the alignment, so you wait 5, 6, 10, 20 seconds and the leg will go short again. But it gives you an idea how the body's positioned, and then you can give an adjustment. Torque release is with an instrument also similar to the activator, and it will help make the adjustment. So this is a more specific technique, and if you want results, the more specific you get, the more precise the adjustment, the better results are going to be. There just aren't a lot of chiropractors doing really precise stuff. Next, DNFT. So directional non-force technique, very similar to TRT and activator. You're doing the challenges, but now you're applying a light force. I do do use DNFT on some people. I like it for low back, mid back, rib issues. We'll challenge, and then we'll make some minor adjustments there. But again, you haven't changed posture. If you took an X-ray, it would look the same. If you look at their posture standing, it would look the same, except for maybe a few rare cases. But they're not gonna. Most of them won't even take X-rays. But they're not gonna hurt you. They're all very gentle techniques, so you don't have to worry about getting injured or strokes or anything like that, because TRT, activator, DNFT are all very, very gentle. And Thompson too. You don't have to worry about getting injured with Thompson. With diversified, you should always take an X-ray before you get adjusted, because if you have a lot of severe degenerative disc disease, you can hurt the person if you go in and give a huge thrust and there's a lot of connective tissue damage. So you always want to take X-rays before you do a diversified adjustment. SOT, a technique I really like. SOT, there's 3 different types, and you use blocks is the main thing, and the blocks use breathing and gravity to make a very gentle adjustment in the pelvis. Now, SOT believes the pelvis, if that's balanced, it'll center your body over gravity. I've found that. I like SOT, but I've found you need to do an upper cervical technique with it, because if that head stays off center, you can block the hips all day long. You're not going to center the body, and you won't see those postural changes that'll make a huge difference for your body. But it's an amazing technique, gets great results. If you're over in Europe or some of the South America, a lot of these countries where they can't take X-rays, try to find an SOT chiropractor or a DNFT chiropractor. They'll get excellent results for you, and it'll be very safe, so you won't need to get you won't need the X-rays. Now, Gonstead. Probably after diversified, activator, Thompson, the next most popular technique. Now, again, very few people do it right, but with Gonstead, you're going to have X-rays. Then you'll do palpation, and you'll do range of motion, checking different ranges of motion, and you'll use a neurocolometer going up and down the spine, looking for nerve rotation. It's measuring temperature, and you'll see the thing swing over in different places. Then you want to do all of that, and then you want to give the adjustment. They won't post X-ray, because segmental adjustments aren't going to make a change on post X-rays, but they will recheck range of motion. That will be better. They'll repalpate. That will be better, and they'll redo the neurocolometer, and that will be better. Okay. So, global techniques. There is Pedabon, which was the first one. CBP, Chiropractic Biophysics, the starter of that, was a partner in Pedabon and then left. And then Clear, CLEAR, it's an acronym for something. But Clear, these are all global. So they're going to give you most likely a diversified adjustment. Then they're going to do a lot of traction therapy exercise. So you'll see people heads, being pulled with weights on shoulders, and you'll do different. And I love the wobble chair. That's a great exercise. That is fantastic. So what they do is they release tension and they mobilize the spine with usually a diversified adjustment. So they get it kind of relaxed, and then they put you in some kind of exercise to force that curve back in the body. But you're not reducing the resistance of the overall body misalignment. So as soon as you stop doing those exercises, you'll go back out of alignment. And you'll see, if you want to keep that curve, you have to keep doing those exercises every day. Most patients find that annoying. They stop doing them, and then they lose their curves. Okay, but they are, if you have to choose between a global and a segmental chiropractor, I would take global. And Clear is a little bit different. They are the experts on scoliosis. So if you have a severe scoliosis and you're getting ready to go into surgery, I would look at Clear. They fix scoliosis. Is amazing. It's, other than NUCCA, one of my favorite techniques. There's going to be a lot of equipment. It is very expensive, but it's worth it. It's a whole lot cheaper than a surgery. You'll go in for several weeks. You'll spend hours in the office doing a lot of exercises, and then they'll send you home with a bunch of exercises to do as well. And Clear does still have quite a bit of upper cervical analysis and adjusting, and they usually do mostly instrument adjusting, whereas CBP and Pedabon, they started upper cervical and they've kind of gone away from it. I'm not sure why. So then upper cervical or Atlas Chiropractic Techniques. The one I do, my favorite, is NUCCA. Okay, that's where you're going to use hands to adjust, and it's an orthogonal. So what that means is you want to get the head and neck balanced and centered in gravity. Because I've seen people with beautiful curves in their necks, and this is always the argument I make with my CVP friends. is they have beautiful curves in the neck, but they're sick, they're in pain. But when you look at their x-ray this way, front to back, they're all twisted up. Okay? So what are you going to do? If your job is to put a curve in the neck and you got a beautiful curve and this person's in all kinds of pain and dysfunction, you got to center that head and neck in gravity. And again, when you off like this, your head goes in front of the body, and over time you lose that curve. And you'll see 80, 90-year-olds, they're like this. At that point, many times, you're not going to make them perfect, but with NUCCA, we can still help a lot of those people and many times get them relief. But if you get a young person, you'll see, you keep that body holding and centered in gravity, that curve with time will come back. And then you can do some tractions if you want, but you don't need to. Okay, and it will hold. You don't have to do any exercises, so people love it. They come in, a lot of my patients come in twice a year just to make sure they're staying in alignment and that body holds without any exercises, because you've reduced the resistance of the entire body misalignment and you've fixed how the body is moving through gravity. Okay? So NUCCA orthosphinology, which I used to do, which is very similar to NUCCA. You're just, for the most part, using instruments. I was a terrible instrument adjuster. I didn't like it. The advantage with NUCCA is you're using your hands. You can feel the resistance, the misalignment. So it gives the doctor more understanding, more feedback on when the adjustment's done and when the person's clear. But it's an excellent technique. I've sent a lot of people to orthosphinology chiropractors. Very, very good. Next, AO. It's called Atlas Orthogonal. There's also Advanced Orthogonal, virtually same. This is a table-mounted instrument. I would do orthosphinology over AO just because lots of times misalignments you need to come low, and you can't come low with a table-mounted instrument. And I get a lot of patients that come from an AO doc who's like 30, 40 minutes from me, and they're always the ones that are low. So he can't get low to get under that skull to bring him back. So he tries to go high on the other side and fulcrum it over. And I'm sure sometimes it works, but lots of times it doesn't clear and the people don't get any relief. So then they come to me, not because I'm super special, it's just with NUCCA I can get low. Okay? Blair. So these are orthogonal. Blair is articular. It's different. They will do, they won't do post x-rays, which is the only thing I don't love about Blair. But they get amazing results. You'll see changes in posture. You will see the adjustment hold. They'll do scans to see if you're holding and see if you're in pattern or out of pattern. And scans are designed for pattern work. A lot of people do them and they're just crack, 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 and your nerves are functioning better. That's not what they're used for. They're misrepresenting the data. It looks cool, it sounds great, but it's not. They're not being honest. Okay, so Blair, you're gonna do scans, postural changes, range of motion changes, and all that to make sure the body is holding. Okay, and it's hard to change posture. So if you improve posture, many times the person is better. The only thing is, lots of times you got to go through multiple phases if the person's had a lot of traumas, and I would guess Blair people struggle with those cases. Next, knee chest, also very good. Upper cervical technique. Then toggle, the oldest. And I'm going to just bring it up. QSM. They lots of times don't do post x-rays. Sometimes they don't even do pre-x-rays. It's all posture based. You need x-rays. Okay. There's just, you're talking about, I've changed people by half a degree, their listing, their angle, and they went from not correcting to correcting. Okay, so, and the only way you can make those kind of precise changes is with x-rays. So, if you're looking for chiropractors, I would try to find an upper cervical chiropractor. I would do QSM last. I would try to find an orthogonal based. If not, I would then do Blair. And of course, NUCCA is my favorite. I do think the hand adjusting gives you a huge advantage over instrument adjusting. It's harder on the body. You got to be more flexible, in better shape, but it's incredibly powerful. And so more specific to less specific is always going to win. Upper cervical, you'll get the best results in the least amount of time, save you money, and you get more improvement. Then global, then segmental. So try to find an upper cervical chiropractor if you can. If not, find someone who's specific. You need x-rays, the upper cervical. So if you're in an area that doesn't have x-rays, again, try to find a DNFT or an SOT chiropractor. They'll get good results for you. You're not going to be able to, the only way to go 3 months, 6 months, or a year and maintain your alignment is if you fix the posture and you get people centered in gravity. So I hope this helps. Dr. FJ, take charge of your health.